Thanks to Lindsay Barbecue for the mask that I received over lunch. Let's see if I can. Thank you for joining me for today's update on COVID-19. I'm glad to be joined today by Dr. Nate Smith, of course, the Secretary of Health. Also pleased to be joined by Dr. Rick Smith, who is the Director of Psychiatric Research at the University of Arkansas Medical Sciences, and then Director Paula Stone, who's Deputy Director at the Department of Human Services. They'll both be speaking a little bit later on mental health services that everybody should be aware of during this emphasis on staying at home and reducing travel and following all the guidelines that we have. I want to first express thanks to all of our workers at the Department of Workforce Services. These employees are out there in the offices having to man the phone. They're having to meet with clients who are seeking unemployment insurance and to process all of the claims. And without them being there, then the 110,000 that have filed for unemployment claims could not be processed. And so they are really under some pressure, but they have embraced this, understanding how important this is to so many Arkansans. I just want to recognize their work and thank them for this. In terms of our case update, yesterday we had 1,023 cases of COVID-19 in Arkansas, with 76 hospitalized. That case count has increased to 1,094 cases in Arkansas, with 73 hospitalized. And I'm looking forward to Dr. Smith and myself will both be talking a little bit more about these numbers, but that is the latest report with that increase in cases, which is fairly consistent with the increase we've seen in recent days. And then if we could go to the graphs that I've had prepared today, and I know this first one has got a lot of different color in it, but let me work you through it because these are Arkansas cases and it's broken down by county. Now the first line there is Arkansas as a whole with 1,097 cases, excuse me, I think it's 1,077 cases. And so this was as of yesterday, I believe, with 18 deaths. And then it has the recoveries as well. But then it has the color lines, which show in the highest red, it means they're increasing at a faster rate. And so this red color is bad, the lighter colors is better. The red color is bad, the lighter colors is better because that means it's growing at a slower rate. And then, and so you can see as the whole state of Arkansas, we are fairly consistent, growing at a slow or moderate rate. And then if you look at the counties, and this is helpful because let's look at Cleburne County, which is this line right here. And in Cleburne County, which was a hot spot, as you know, and as you see Cleburne County, the red is the middle, and then it decreased where it is almost slowed to nothing in terms of growth. And so this is illustrative, county by county, how you can peak and then you start winning the battle because of the social distancing, because you're following the guidelines, and the cases, instead of spreading in a hot spot, actually decline. And so hats off to Cleburne County for their success and how they've reduced that spread. You can look also here in Benton County. There's 45 cases, I believe it is, for the whole county. They were hit early on, but then because of social distancing, some of the success, that has slowed dramatically in terms of the spread. So you can go through the different counties, but I think that is instructive to us. And then if you go to the second chart that we have here, or graph, and these are hospitalizations. Again, not cases, but hospitalizations, which is probably everyone's agreeing might be the easiest statistic that is solid, that is hard to say it's not reflective of what's happening out there. And so I asked them to put together the SEC teams, the SEC states, and so we've got from Louisiana to Florida over to Arkansas. It's got Kentucky, South Carolina, all of the SEC states here, basically southern states, including Texas. And you can see the hospitalizations per 100,000, where Louisiana, obviously, as the hottest spot, has such a high level of hospitalizations per 100,000 population, with Georgia, with Mississippi, Florida, South Carolina, and it goes on down. As you can see on the far right is Arkansas in that white color there, and Arkansas is, it's not basketball, but this is COVID-19, and we're grateful because Arkansas is really showing that it is up to the task, that we are distancing, that we're following the guidelines, and as a result of that, our hospitalizations in Arkansas per 100,000 is less than their surrounding states and those other states in the South. And as Dr. Smith could point out, there's a lot of factors that go into this. Florida has, an older population, so, they have to struggle a little bit more with their rate of hospitalizations. We have somewhat of an older population in Arkansas as well. So I think, the strategy works, what we're doing, what the public is doing works, and they ought to be encouraged by that. This could change in a moment's notice if we don't do the right thing. And so let's go to the next chart, and we'll do this very quickly because this really shows the same thing. It's just in a larger color map in a different way with the maps. But this is the same SEC states from Kentucky to Texas. Texas, 5.9 hospitalizations per 100,000. Oklahoma, 10.4. Louisiana, 40-some. And then Missouri, 8.7. Arkansas, 2.6. Mississippi, 13. And so we are surrounded by states that have a higher level of cases, but particularly hospitalizations per capita. And the message here needs to be reinforced that we're surrounded by Louisiana is certainly a hot spot. Some of the other states have that potential. We need to reduce our recreational, our unnecessary, out-of-state travel. That shouldn't be happening. Obviously, if you're delivering critical supplies, it needs to be done. But this is the reason we quarantine. We ask people to quarantine if they come from a hot spot. We don't want to bring this in and increase our risk. There's people on the border that have to go back and forth for the work purposes, we understand. But let's make sure that we keep those numbers down and that we understand the risk of travel and what that means to our state. If we go to the next slide, this is the expected versus actual hospital bed use in Arkansas. Now, these are numbers here. The projection comes from the University of Washington. They call it IHME projection and modeling, but it's done by the University of Washington. It's not by anybody in-house. This is nationally examined. This has been quoted and cited and referenced by the White House in their daily briefings. And so we looked at where is Arkansas. Now first, if you go back to their models a month ago, you would have seen this red line go through the roof. But they adjust their model as they should based upon new data that comes in from Arkansas. So this is their latest model though, which is the red line, which is expected hospital bed use. And as you can see, their red line has us around this time in April at having about 170 actual COVID-19 patients in the hospital. And as you know, we've been holding steady around 70. And the steadiness is what is nice to see because, as Dr. Smith will explain, that indicates that we're reducing that spread and we're also releasing people from the hospital. And so with that, let me turn this back over to Dr. Smith. But before I do, I just want to urge all Arkansans as we approach this weekend, don't take anything for granted. Understand where we are and the importance of not violating the limitations on social gatherings. We don't need to be out with 20 friends. It might be good weather. We need to restrain ourselves. We need to follow the guidelines and wear your mask. If you can't socially distance, protect yourself and protect others. Dr. Smith.
Thank you, Governor. Just to give a little bit more detail on some of these numbers, I'm going to start with the new cases. As the Governor mentioned, we've had 71 new cases since yesterday, bringing our total to 1,094. Do we have the next slide? Thank you. What I'm showing here in the blue is that total positive cases, the cumulative cases. That's today the 1,094. But the bottom line is the total recovered cases. And so the difference between those two are our active cases. And I'm going to start reporting on active cases as well, because it's not just the total that we've ever had, but it's the number of active cases. And we're at 841 active cases as of today. We have one new county, Madison County. We have currently hospitalized 73, which is 3 fewer than yesterday, but we have had 21 newly hospitalized. So what that means is that we've had 21 who have been admitted to the hospital since yesterday, but since we've dropped by 3, that means we've had 24 that have left the hospital. So although we're continuing to have new people hospitalized, we're also releasing people from the hospital, and eventually they'll move into the recovered category. So in terms of the total number of people who are in the hospital with COVID-19, that's staying relatively the same, even though we're having newly admitted patients and then some who are being discharged. We have 31 who are currently on a ventilator, and that's one more than we had yesterday. And we're up to 21 deaths. Unfortunately, that's 3 more than we had yesterday. And just to give some detail on those 3, 2 of them were in their 60s and 1 was in their 70s. We have now 253 who have recovered, and that's 45 more than yesterday. And we have 158 healthcare workers. That's 18 more than we had yesterday. Now I've gotten some questions about what it means to be recovered. You know, if you've been exposed, or if you've been diagnosed, when can you go back to work? And I've gone over that before, but I'm going to go over that again just to help people to understand and emphasize some points. We'll start with this idea of quarantine. Quarantine is someone who's not tested positive, but who has been exposed. For example, and the governor showed you that map, you know, basically all of the surrounding states have higher rates of COVID-19 per capita than we do right now. Say a person came from one of those states that has a lot of COVID-19, or maybe is being repatriated, having come back from overseas in a country where there's a lot of COVID-19. And then they arrive in Arkansas. We say they're supposed to self-quarantine for 14 days. And that 14 days is taken from their last exposure, from when they were last in that other country or state with lots of COVID-19. So when they arrive in Arkansas, that's when the 14 days starts. And they should go a whole 14 days. If they develop symptoms during that time, they need to be tested. If they don't have any symptoms during that time after the 14 days is over, then they can resume their activities. Obviously taking care with social distancing, etc. If someone is exposed, for example, by being in contact with maybe a coworker or a family member, that 14 days starts from their last exposure, the last time they were in close contact with that coworker, that friend, or that family member. And again, 14 days. If they develop symptoms, they need to be tested. But they need to be out during that time. Now, the CDC has just recently come out with some special guidelines for those who are considered essential workers or in essential positions. For example, say you were a doctor, a nurse, or caring for patients in a nursing home, and it could be that everyone was exposed. You can't send everyone home for 14 days because there'd be no one there at all to take care of the patients. In those cases, if someone has been exposed but they have no symptoms, they are permitted to return to work wearing a mask and having frequent temperature checks and symptom checks. If they develop symptoms or a fever at any point, then they're of course excluded and they need to get tested. But for those people in essential positions, the CDC has provided guidance that continues to protect the people around them, but also makes it possible to care for patients and to perform other essential functions. Isolation is when someone is actually tested positive. If someone actually tests positive, then they need to remain at home until 7 days from the onset of their symptoms, from the first time they develop symptoms, and they have to be at least 3 days without fever. So if someone developed a cough and then 7 days later they're feeling fine and they've not had a fever for 3 or 4 days, they can go back to work. Now, if it's been 7 days since their cough began and they're still running a fever, or they had a fever yesterday or the day before, no, they've got to wait until they've been at least 3 days free of fever. It's a shorter period of time for someone who's actually tested positive because they've already gone through that incubation period, but it's 7 days since the onset of symptoms. Now, sometimes people are test positive and they don't have symptoms at all. In that case, we start the 7 days from when they had that positive test. Finally, I just want to reemphasize what the governor said about travel. For those coming from other states, for those coming from other countries, being repatriated, we are hoping that people will take that seriously and do the 14 days of self-quarantine. When we're notified about those travelers, then we try and reemphasize that message. But for the rest of us, when you're out and about, we hope everyone's doing the right thing, but don't take it for granted that the person standing next to you didn't perhaps just come from another state with a lot of COVID-19 exposure, with a lot of spread of COVID-19. And take those precautions. Wear your mask, maintain 6-foot distance, and then wash hands frequently, and do all the things that we've been talking about this last month. With that, I'm going to turn it back over to the governor. Thank you.
Thank you, Nate. And as we indicated, this is a time when we ought to be concerned about depression. We ought to be concerned about mental health issues and the help that you can reach out to for that purpose. And with that, I'd like to recognize Dr. Rick Smith.
Thank you, Governor, and thank you, Secretary Smith. All Arkansans are grateful for your strong, dedicated leadership during this public health emergency. First, to my fellow citizens on radio, the internet, and television, I want to urge you to pause a moment and take a deep breath. This will help you cope with the stress. In fact, during this long emergency, we need you to do this multiple times a day, to pause, disconnect from the urgency of the situation, and relax. This emergency is reminiscent of the flood we had in Arkansas last year. We knew it was coming for weeks, and even after it crested, the water was high and dangerous for weeks to come. Unfortunately, the same is true for this crisis. However, just like the flood, this crisis too will end and we will return slowly to normal activities. Everyone needs to be mindful of maintaining his or her mental health and assisting others where that is feasible and, as Dr. Smith said, and safe. Secondly, I want to recognize the emotional toll of COVID-19 and the particular stress on those with underlying or existing behavioral health or substance use disorders, as the governor said about depression. This type of emergency will be especially challenging for you. It is not the time to stop your treatment or to relax those activities that you know are helpful to you. Please call your provider, your physician, your sponsor, your clergy person, whomever it is that helps you through difficult times. Most clinical providers are open in some form or fashion. Some will have televideo services available to you, and all hopefully will be providing care by telephone. Most providers now have emergency services for their existing patients. Finally, please take care of yourself emotionally and reach out to others safely during these distressing times. Thank you.
Thank you, Dr. Smith. And then, Paula, if you could come and talk from a Department of Human Services perspective as to what assistance is available.
Thank you, Governor, and thank you for your support for mental health and substance use disorder services. We want everyone to know that every Arkansan has the ability to access a mental health or an addiction service. Those counseling services are available. If you have insurance, you can call your insurance company and they can help you find a provider that can provide counseling services. If you have Medicaid or you don't have insurance, or your insurance company wasn't able to help you find a provider, you can call our line. We have a DHS Mental Health and Addiction Services support line. That line is 844-763-0198. And that line is open and operated Monday through Friday from 8 a.m. to 4:30 p.m. You can call and talk to a person, and they would help you find a list of providers that are providing services in your areas. You can call that provider and schedule an appointment for an assessment. An assessment will let you know exactly what kind of service you need. And most of our providers, if not all of our providers, are able to provide those services via telemedicine. Those include the assessment services for just the initial assessment. It also includes individual counseling services are available through telemedicine with all of our providers. It also includes marriage and family therapy, so you can have that service and you may need that service and then you may need to include your family members in that service, and that can be provided. And then we also have a service called crisis intervention, and that's if you suddenly have a crisis and you need to speak with somebody immediately and you don't really need to go through that assessment process, and you can speak to somebody on a crisis basis. So all of the services are available, and even those people who have not received services in the past may be identifying some needs for those services during this time. So we want to make sure that every Arkansan knows that those services are available for you to access if you need them. Thank you.
Thank you, Paula. With that, we'll take any questions.
One question that somebody asked us, given the amount of the amount that it has cost the state to impose all of these restrictions on the economy, why wouldn't it be feasible to just like hire a massive number of people to test, to do like contact investigations of everybody who's tested positive and just like really isolate people who are positive?
Well, the contact investigations are very important, and Dr. Smith and the public health team has been doing that as we get positive cases. And I've also extended to him the offer to enhance the contact tracing capacity, and that we can move more resources there. They have to be trained, but I think this is a very important capability for the future. I think about being prepared for next year also if this comes back, and that we want to have greater capability of doing contact tracing, of having trained resources. So it is very important, and that minimizes economic damage as well. And with that, Dr. Smith, you probably want to elaborate a little bit.
Yeah, thank you. That's a really good question. And I want to make a distinction between case follow-up, which is, I think, what you were asking about, and contact investigation, which is actually investigating all the people that that individual may have come in contact with. We are doing case follow-up on all of these. Obviously, once someone is recovered, we don't need to continue following them, but we have 30 or more nurses who are following up on each of these cases. We are training additional personnel to help us to do that as our cases grow, and we have an electronic solution that we are using to keep in touch with these patients. We're bringing on a new one that will have enhanced capabilities. So we'll continue to grow that. Contact investigation is also important. We are prioritizing those situations where it's a healthcare setting, a healthcare worker, for example, or a hospitalized patient, and especially, as you know well, the long-term care facilities, especially the nursing homes, and that's been a major focus. So we're doing active contact investigations in those settings, as well as other congregate settings. As we go on, that will become more and more important, especially when we get to the downside of this curve and we start resuming normal activities. We'll be doing this more like we did at the beginning and more like we do for any other kind of communicable disease. If there's a case of mumps, we investigate all the contacts. Now, when we've got 71 new positive cases, it can take a while to do a contact investigation for all 70, so we are prioritizing at this point, but that's very important. We're building our capacity in terms of personnel, building our capacity in terms of software solutions, electronic solutions, and we also, I haven't mentioned the sort of legal aspect of it. Most people, when they test positive, they do the right thing, or if they've been exposed, they'll self-quarantine, but occasionally there's those who don't, or for some reason have problems with that, and when we need to, we're issuing orders of quarantine or orders of isolation to support that in partnership with local law enforcement. And also for those who have challenges with housing, we're working to find solutions for them as well.
I guess the question was, would it be feasible to hire enough people to do contact tracing, the actual contact tracing on every new case?
Theoretically, it would, but the problem is that you really have to train people how to do this properly, and the people who would be training them are the people who are actually doing it now. If this were a little bit more slow-moving, we could have some of our experienced contact investigators be doing all this training, but right now it would kind of shut us down if we had to do that. So we are incrementally increasing that. We'll continue to do that.
Next question.
To follow that question, as we continue to see the healthcare workers' cases increase, are there any additional healthcare workers who haven't tested positive that are being quarantined as protocol? We were told that UMAS a while ago had quarantined 64 employees early on.
Yes, anytime there's been an exposure, for example, a healthcare worker came in contact with a patient and perhaps they came in contact before proper PPE was, before it was suspected that the patient had COVID-19. Anytime there's an exposure, what we've been doing is sending those individuals home for the 14 days of quarantine. Now, if we need to, with the new CDC guidance, if that person is not symptomatic, they're checking their temperature multiple times a day, checking for symptoms and wearing a mask all the time, they can come back if they're needed, so that we don't lose all of our healthcare workers.
Governor, the federal government's ending funding for testing sites on Friday. Does this have an impact on Arkansas? And if so, what are your thoughts on this?
All right, I'm sorry, I missed a little bit of it. This is if...
The federal government's ending funding for their testing sites around different states on Friday. And so I was wondering if that has an impact on Arkansas, and what are your thoughts on this?
Well, in terms of the federal government's support, of course, our challenge has been simply getting the reagents, the ingredients for our testing machines or testing capacity. And that's been slowing us down in our public health laboratory as well as at UAMS. I was pleased that CDC actually took charge of that and said, we're going to be supplying the states and their public health laboratories the reagents that are needed. And so I like that step in it. In terms of the national reliance on testing has been through the commercial labs. And so that has been their pattern, and we're relying upon the commercial labs. They do at least 2/3 of the testing results that we have in Arkansas come from those commercial labs. Now, we continually get, well, it's been 5 days or it's been 4 days before we get those results back. That's just the volume of cases that they're seeing from New York to California, and when they get our test kit in, it has to wait till it's brought up. So we'd like to see that increase in terms of speed, but that is a commercial capacity. Did I answer your question?
Yes, I think so. So we don't have any federal sites testing in the state of Arkansas. I wasn't aware of any, but I wanted to make sure.
I should have given a shorter answer there. By the way, congratulations on the #1 score on the bar exam.
Thank you, I appreciate that.
We do have a remote question. Is it possible to ask one?
We'd love to hear from you. Let's take a remote question and we'll come back.
Thank you. This is a long-term kind of economic impact question for you. Yesterday you had mentioned that obviously reopening businesses in the state is still something that is in the future. When that time comes, what are going to be the signs that the state needs to see before you consider reopening businesses? And have you discussed criteria that will need to be followed before that time comes?
We're developing that process as we go along. The first thing you have to see is that we have confidence that we've reached the peak. And while it looks like we're slowing the growth down, there still is some growth in the number of cases. And so we have to reach the peak where we see, the active cases going down. And so we're not there yet. And once we see that, then I think we can have more concrete plans. What we've been doing in Arkansas is to make sure our essential services continue, that obviously the people who have to get out to participate in that use protective measures, and with that I think we're going to get to that point that we can reopen quicker. I can't give you a time frame at this point. The University of Washington study, the last thing I saw was that they anticipated that we'd peak about April 24th, and then sometime after that we can start looking at the future, but we're not to that point yet. Is there another question remotely before we come back to the table?
Yeah, Governor, this is Andrew with AP.
Yes, Andrew?
Wanted to follow up on your comments yesterday regarding investigating the abortion provider, Little Rock Family Planning. Want to ask about the status of that investigation, and are you looking at this point following up the directive on elective surgeries with something more specific, telling them to not perform abortions or to restrict the type of abortions they can perform?
It's my understanding that the Department of Health has done on-site inspection, and that they have a report, and they're looking at further directives or action in that regard. The concern is for all of the clinics that are in an urban area that do elective procedures that are not time sensitive, that they delay operations, that they postpone those. And we expect that of all of our clinics, and that's what we're looking at. Dr. Smith, did you have a further comment there?
Yes, as the governor stated, we have done an investigation. We have found that a significant portion of the patients were coming from surrounding states, and have advised them to discourage that for the reason that you saw. We have higher rates of COVID-19 transmission spread cases in our surrounding states. If they choose to do that, I think that will be a good thing, and if they don't, then of course, just like if it were any other medical or surgical center bringing people from out of state, we would consider further directives.
It sounds like for people in the state, Arkansas residents, it's still okay for them to have abortions. Is that what you're saying?
Well, we've discouraged any kind of elective procedure, anything that can be postponed for obvious reasons. But for all of our surgical centers, for example, we've realized that the judgment on whether something can wait or not safely really needs to be primarily made by that clinical provider.
Do we have an update on the CMS waiver and the extra money for healthcare workers in long-term care facilities?
The question is on the CMS waiver that would allow additional payments for those that are direct care for COVID patients. We have not received a positive response on that, which I'm disappointed in. They continue to review it. They haven't said no yet, but they haven't said yes. And part of the issue, quite frankly, is that this is a Medicaid waiver, and they are looking at whether the request is supported. They understand the importance of this, but there's a debate as to whether that should be provided by Medicaid funds or whether that should come out of the federal money that's going to be going to the states for COVID-related expenses and cost. And so that's an OMB type discussion. I stress the urgency of it. We can't wait because that money is not going to be coming until late April. And then the time you make decisions on that, that's not quick enough for our workers. And so I'm frustrated by that, but we have not received the waiver, and that would be the other option that we would have to look at if that happened, if we did not get the waiver. Yes, ma'am.
Are there any updates on Forest City Correctional Facility or any of the new cases from there?
The CDC team has gone on site today, so we're hoping we'll have more updates to present tomorrow. But I don't have any updates at this time.
The plasma donations, do we have an update on that as well? Also, we've received questions from folks, once you've recovered, do you have an immunity to it?
In terms of the plasma donations, those are supposed to begin today. I hate to state something that's going to happen until we make sure that it actually does. The idea there is to collect plasma from people who've recovered because it will have antibodies, and we believe there's a good chance that that will actually help people who are severely ill to recover. Now, the question of if you've recovered, are you now immune? Presumably there's at least some immunity because we're not seeing a bunch of people get it a second time, but how strong that protection is and how long it lasts, we don't really know at this time. So we're having to be cautious with those who've recovered. They still need to take precautions just like everyone else.
Is there another question remotely? If not, any other questions?
Governor, I had one more question. I wanted to ask you about the joint budget this morning. Had rejected a proposal to allow no excuse absentee voting through the end of the year, so it could be in place for the general election. I know you had a waiver. You had waived that for the runoff last month. What do you think about their proposal, and are you looking at all about extending your order to, if you could, extending your order to the fall, the legislature?
Well, thank you. And the question is about no excuse absentee voting for the fall election in November. It's my understanding that the General Assembly simply had reservations in a very truncated session in which there's health risk and people want to do their business and go home, that That takes a higher threshold of vote. It's substantive legislation versus budget legislation. And so I think more on that, the inability to get it done in a fiscal session was the issue. It's something that we don't know whether in November there's going to be an emergency or not. We all hope that there will not be. And so I think that issue just has to be addressed in a different fashion. Certainly, if we have a continued emergency, I would be open to the possibility of waiving the rules so that we could do the no excuse absentee voting, which certainly is important and helpful if you have the threat of COVID-19. One last question on the table, please.
We've received a lot of concern from folks worried about big box stores. You know, so many of us are going to Kroger or Walmart these days. Will the Department of Health release that information if there's any possible exposure at these stores, or what goes into determining whether or not that's something of the public interest that should be released?
I'll let Dr. Smith answer that, but let me first say that I get reports every day from people who are out there shopping in large stores, whether it's grocery stores or larger stores, that they're enforcing social discipline. One report was that 3/4 of the people in the store, both customers and staff, were wearing masks and gloves. And so there's really a concentration on it. Sometimes people drive by and they see a lot of cars outside and they think, my goodness, this is terrible. But in fact, as you get closer to it, you see that they are spacing, that they're having limitations. If they're not doing that, then we certainly will look at more intentional action to make sure those precautions are taken. But you might want to comment on the public side of the reports.
And if there needs to be public notification to alert those who might have been exposed, certainly we would do that. Otherwise, we'll contact individuals who are exposed individually. And that's for all contact investigations.
I think the question, though, was if there's a report about a big box store or large...
An employee at a big box store that might be positive.
Well, if they're... Right. If there was an employee who tested positive, we wouldn't necessarily make a public notification on that unless there were members of the public who were exposed who we couldn't reach in another way.
Thank you very much today.